Hi, please find all the components in the A2M kit with scaffolding. Our first step is to preheat the warmer. Start by turning the warmer on. Next, set the temperature to 75.5 degrees for 10 minutes. Press start. Now we are going to prep our blood collection tubes for the blood draw. Pull each plunger down as shown in the video until you hear a click sound. Then you snap the plunger from the blood collection tube. You will do this to all blood collection tubes. Next, we are going to draw our patient's blood. We like to use a piece of medical tape to hold the butterfly needle in place. Please note how she is connecting the adapter on and off the blood collection tube. These tubes automatically fill on their own. Once full, you will see that the blood stops flowing in the tube. For reference, it stops filling at the top of the sticker on the blood collection tube. Please be sure to fill each blood collection tube completely full of blood or it will throw off the centrifuge. Once the tube is full of blood, disconnect, invert the tube back and forth to mix the heparin beads. Please be sure to invert the tubes at least 3 to 4 times. Please note, if you are using a Dr. Kiss centrifuge, please remove the yellow tubes from the centrifuge. We will place our blood collection tubes in the centrifuge at 3,500 RPM for 8 minutes and press start. While our centrifuge is running, we will go prep our filter. Please follow along in the video by attaching the blue port to the top right of the filter. Locate the 60 ml backlock syringe in your kit. Push the air out. And connect it to the top of the port. Now we will remove the end cap as shown on the left-hand side of the filter. Grab out the empty 60 ml syringe and connect it to the filter. Now that our centrifuge is done, we will remove the blood collection tubes and place them in a working area. Take your alcohol prep pad and clean the top of each blood collection tube. Grab your red cap and we are going to depressurize the blood collection tubes. See how she is taking each blood collection tube and placing it on the end of the red cap. Until she hears a click or feels the red cap break the seal, that's when she knows the blood collection tube has been depressurized. You will now grab the 60 ml syringe with the transfer device connected in your kit to begin drawing off all 15 tubes of plasma, saving the last tube for bioscaffolding. You may need to release air from your 60 ml syringe as shown in the video. Once you have drawn all 15 tubes of blood, grab your 6 ml syringe in your kit with the red cap. As shown, you will cap off your 60 ml syringe. Connect the transfer device to your 6 ml, and you will now draw off the last blood collection tube for bioscaffolding. Once done, remove the transfer device. Cap off your bioscaffolding and place it in the warmer at 75.5 degrees for 10 minutes. Now we will go back to our filter and remove the end cap on the right-hand side, connecting our 60 ml syringe with platelet poor plasma. You will now locate the 60 ml backlock syringe on the top of the filter, pulling the plunger up and locking it. You will start pushing the plasma through the filter. Go back and forth as shown in the video. You may notice on the 4th or 5th time, you will see clear fluid enter the vac lock. You will need to pay close attention to your 60 ml syringe going back and forth until you reach the desired concentration amount of A2M that you need. Once you get that amount, you will remove the vac lock and place that off to the side. You will then remove the empty 60 ml syringe from your filter. You will now pull the remaining amount of product from each side of the filter. You are now left with very concentrated A2M in your syringe. Cap off your A2M and set it to the side. You will now take your cooled off bioscaffolding and push it through the 30 ml syringe found in your kit. Connect your very concentrated A2M in your 60 ml to your 30 ml syringe and begin mixing the bioscaffolding with A2M back and forth. You will do this approximately 10 to 15 times. Once you are done mixing, you now have your final product. This process is used by Buckeye Physical Medicine and Rehab.